Hello, welcome back to the Better Winds podcast. So, I want to talk real quick about what are you supposed to do if you are having an open wound after surgery and you're nowhere near your surgeon. I am Heather Flexer. I'm a certified wound specialist and creator consultant over at betterwounds.com. And I work mostly with plastic surgery folks that are post plastic surgery people that are having complications that include wound issues. So it's a common thing that I have people reach out to me and they're kind of in panic mode. And that's probably how they found me to begin with. But what do we do? So, one of the big things is, when you come back, if you've had surgery not near you locally, it's often hard to get someone to want to touch the incision or to really give you feedback. So, unfortunately, that puts some of you in an unfortunate predicament, right? But what are you going to do? So, your options, right? They're to go to the ER, go to urgent care, get in touch with a wound care specialist, go to your primary care doc. What are you supposed to do? So I would only go to the emergency room if you are having obvious signs of infection and or some kind of other reaction where you need emergent care. If your wound opens up and it just opens up but isn't infected, like we're not seeing signs of redness or cellulitis, we don't have tons of odor. We don't have green, smelly drainage coming out of it. If it's just that it opened, they are probably not going to do much to you. They may clean you up. They may pop out some stitches if they're in the way or not healing right. They're just going to kind of give you a cleanup and they're going to maybe give you some antibiotics and send you on your way. I have had a few people that have reached out that were obviously having massive infection issues who wound up being admitted. Which I was so happy that they reached out and so happy to send them, to be like, no, you need to go directly to the hospital because that's risking your life. You have an open wound. That's a main portal for infection. You can literally go septic and you can die. So it's not anything to mess around with, but you don't necessarily want to go straight to the emergency department if you don't have any signs of infection just because you have an open wound, because they aren't going to do too much. So if you already have scripts for antibiotics and you have an open wound, you probably could try reaching out to your primary care provider. And I know many folks use urgent cares as their primary care provider. So that's kind of could be synonymous if that's your situation. So really what's going to be the main deciding factor is if you're looking at signs and symptoms of infection. And that may include what they call malaise, general malaise. So you really just feel like crap. Maybe the wound doesn't look that bad, but you look and feel like you have the flu or you can barely move or you're just kind of fading. That's a reason to go to the emergency department. So just keep those things in mind. I know this is, if you have an opening in your body, of course you are like freaking out and super anxious. So you just want to kind of keep those things in perspective as well, because you're going to get frustrated when you show up to the emergency room and they are pretty much send you home. So you can always start at urgent care or your primary care provider if you're not in an emergency situation. And if they are super worried about you, they'll send you to the emergency room. You can always try that as well. You can always go that route. Now, the other place that you may want to consider is getting in touch with your local wound center. So you can really just Google wound center near me and tell them your situation, find out what do they need to accept new patients. Not all of them require a referral. I know that keeps some of you away from the wound center, thinking that they're not going to work with you because you had your surgery somewhere else. But I have not really had that experience with all the, clients that I've been working with. Some wind up working with me and their doctor or in their wound center, and I just try to collaborate all around the board with everybody and just kind of give the clients some feedback and let them know what to ask for, and it gives them kind of a sense of control and understanding about what's going on or why they're saying this. Or it can be quite confusing when you're, especially if you're on social media and in some, groups and things. You'll have people tell you to use certain products. It worked for me and it'll work for you. And sometimes it will and sometimes it won't. So sometimes it's not necessarily about the product, but about using it at the right time. So your wound center and going to a wound center is going to be a great idea, especially if you have that necrotic tissue present and you need to have debridement or you need multiple debridements. So don't be afraid to Google wound center near me, call your insurance company, see how much it is. You don't necessarily have to go there forever. You don't have to go there until your wound closes. Many of you are pretty well versed at taking care of your wounds at home. That's something that I've definitely learned from working with all of you. Many of you have like a bunch of supplies already sitting at home for whatever reason you bought it and you have a stash. So, but getting the wound debrided down, get rid of all that necrotic tissue is going to help you heal faster. So if you have an open wound, if you have necrotic tissue, getting that taken care of, right, it's going to have your wound heal faster. It's going to have you have a better scar. So, you have lots of options. You can always contact your primary care provider as well. They may feel comfortable doing it. They may want to send you a referral. You can contact your insurance, see, how they want you to proceed to make sure that your visits are going to be covered. And those are all great resources. If you have insurance, call them, see what they want you to do. But, save the emergency room for like emergencies. You have an infection, you really don't feel right, things don't look good, then that is something that you want to definitely reach out that way. But you always have those other options of your primary care provider, and urgent care are great options as well. So if you're really worried about what you're looking at and you've tried all these options and none of them are, you're just don't feel like you're getting the advice you need, you can always reach out. You can find me at betterwounds.com, or you can send me picture. I do a lot of this kind of thing over Instagram. You can reach out on Instagram. But betterwounds.com, you can grab yourself a consult at the /shop and use code podcast, and that's how you can talk to me directly, and we'll talk about your wound directly, and I'll point you in the best direction that I can. And if we can manage it at home, then I'll be more than happy to help you figure that out. So you can reach out if you need help. I hope you're good. If you're not, you know how to reach me, and we'll talk next time. Thanks so much. Bye.